No more moaning, you're my serotonin, you know. Yes, and often you cause my emotions to grow. When the sky is dark as night and the moon is only a crescent, I feel effervescent, 'cause my antidepressant is you. My name is Jessica Greer Morris, and I live in Brooklyn. I would define myself as a community organizer, a human rights advocate, and a social justice activist. I am a public servant who worked for the city for 16 years, many different agencies. The last agency was at the New York City Department of Health, where I dedicated 7 incredible years of my life, one of which is I was a first responder after the World Trade Center disaster. When I was Director of Community Relations, I was so proud of that title because focusing on community needs has been something that I feel is in my DNA. I come from a Jewish heritage. My mother was a social worker, and I remember the term tikkun olam, which means to repair the world. So when I think about my DNA and what's been carried on by my ancestors, healing the world has been such a central part of my life. I loved working at the health department, and one of the things that inspired me the most is they say that a doctor saves one life at a time. And in public health, we do it by the millions. And so being a public servant in New York City was so excited because I got to address the millions, right? The millions of people in New York that have health concerns. On the day of the World Trade Center disaster, I was coming up from the subway and looking up at the sky and I saw the first plane had hit. And I went straight to the office. We had 6,000 employees. We sent all employees home except a small group of senior managers. And those senior managers created triage. So we cleared the first floor. It's really the entryway of 125 Worth Street. And we created a triage with doctors and nurses. And one of the most tragic things that happened is we waited there. And we waited there. And there would be people that we'd see come by, like with rubble all over their bodies. So, we might help dust them off or clean them off. But there was no one there for the medical triage because everyone had died. And there was a line that formed outside of 125 Worth Street because all the people coming from the tragedy were wanting to volunteer at the triage. So we had a long line of volunteers, of people who had just come from a tragedy, but we didn't have patients to serve. So there were moments like that during the World Trade Center disaster, day of, weeks after, months after, years after, that I will never, ever forget. So I was a first responder who went to, we called it the pile. Some people called it ground zero, where I would do fit testing to make sure the first responders that were going and cleaning up the area were protected. And so there would just be these long lines where we would give them masks and have them use these masks. And I have to tell you, one of the greatest heartaches from that period is many people I would fit the mask for, and some of them would put it on their belt and not wear it. And then we know for many years later that a lot of them suffered. And it was just, hearing that news is, and then watching it happen is one thing that's important to know about public health is you can't force someone to wear a helmet if they're riding a bike, and you can't force someone to wear a mask if they're going to an area where there's pollutants in the air and you don't know what those pollutants are. So it's really important that we focus on both physical health and mental health, which is often forgotten. So I think one of the most important things about the World Trade Center Health Registry is that failure is a lesson. And we need to understand what happened to survivors and first responders, whether it's physical health or mental health. We need that data in order to pave the way for a healthier future for everyone.